Hello, welcome everybody. Thank you so much for joining us today for Access to Veterinary Care, Insights, Barriers, and Next Steps. We're delighted to host this Meet the Authors session, where we'll explore the findings from our report, Access to Veterinary Care, Barriers and Insights from Pet Families. This report sheds light on the lived experiences of pet families who have faced challenges accessing veterinary care, and hopefully will point us toward more solutions by working together. I'm T. Fisher, Director of Operations at the Program for Pet Health Equity, and I'll be your co-host for today's session. Before we get started, please take a quick moment to type in your name and your organization name into the chat. We'd love to know who's with us today. Thank you. Yeah, it's great. It's wonderful to see so many of you here with us today. Everyone is muted for the presentation, so you'll only hear from our speakers. Please drop any questions you have into the chat or the Q&A window. Our research associate, Caitlin Davis, will be keeping an eye on them for us. And any questions we don't get to during the presentation will be revisited at the end for discussion. Before we begin, we'd like to take a moment to thank Maddie's Fund. This report was made possible through their generous support, and we are so grateful for all they do to advance access to care and strengthen the human-animal bond. So thank you, Maddie's Fund. All right, well, it's my pleasure to introduce you to our two distinguished authors, Linda Doherty. Linda was a driving force in advancing research on access to veterinary care through her work with us. During her time as Associate Director of Research, she co-authored several key studies that have shaped national conversations on access and equity in veterinary services. Also with us, Claire Schuch. Claire recently joined PPHE as Associate Director of Research. She comes to us with more than a decade of experience in community-engaged research, program evaluation, and applied health equity work. Her interdisciplinary background spans public health, social justice, and education. Next, Claire and Linda will walk us through today's study, the methodology, highlight some of the key findings, and share how we're viewing the data through a One Health perspective. They'll also talk about some of the next steps that may come out of this report. And after their presentation, we'll take the remaining time to answer any questions you've added to the chat. All right, let's begin. With that, Linda, I'll turn it over to you.
All right, thank you, T, and thank you everyone for being here. Hopefully we will be able to answer any burning questions that you have about this report that's just been released. I am going to provide a little bit of background about the original study and just to provide some context about decisions that were made and how the current study was done. So the original Access to Veterinary Care study and the seminal report that followed, Access to Veterinary Care, Barriers, Current Practices, and Public Policy, you see the symbol there, culminated from the formation of the Access to Veterinary Care Coalition. And I'm going to refer to that as the AVCC as we move forward. This group first met in 2016 and commissioned a national study to better understand the prevalence of barriers to veterinary care being experienced by the nation's pet families. And at that time, I was directing the Center for Applied Research and Evaluation at the University of Tennessee and collaborated with the AVCC to develop the research questions that guided that study. And I'd like to do a shout out for just a moment to the members of the original coalition and current members too, because they have just been invaluable in the expertise and that they have provided for both studies. So in the original study, not only did we want to better understand the types and prevalence of barriers, but we also wanted to better understand who was experiencing them and if there were any differences. So for instance, how did geography, socioeconomic status, and other demographic characteristics impact the type and prevalence of barriers? So we worked together with the AVCC to create the survey items that would help us to answer the research questions. And we conducted a cross-sectional population survey of pet families in the fall of 2017 and spring of 2018. And to qualify for participation in that study or in that particular study and survey, the respondent had to be able to answer positively the question, do you currently have a dog or cat living in your household? Okay, I need to go to the next screen. T, can you not able to advance? Great, thank you. So survey questions for the original study were designed to ask about each pet in the household, specifically questions about their species, their age, and how the family acquired the pet, and whether or not the pet had been spayed or neutered. And we asked about whether the family had experienced a barrier for 3 types of veterinary care: preventative, sick or injury, and emergency care. And for each of those types, we asked the frequency for experiencing the barrier and the reason for the barrier. So when the current study was being designed, we had to make some methodological decisions. For instance, should it be a longitudinal study in which we replicated all aspects of the study, or should we just do a second cross-sectional study based upon the original study, but adapting the survey and the methodology to reflect the current environment so that we could better inform the future? And we decided the latter, but we did largely draw from the original survey as much as possible, but incorporated what we had learned during conducting community surveys with pet families. And we'll talk about those changes, but the changes were really based upon what we've been hearing in our other research. Excuse me. So, T, if you want to click to that next set, not the next page, but okay. So for both studies, the goal was to produce a data set that would allow us to stratify the sample so results could be reported by income categories within each of the 4 geographic regions of our nation as defined by the Census Bureau, and by including 400 pet households in each of the 3 income categories. And we chose income categories based upon the federal poverty level. One category was less than 138% of the FPL. The second was 138 to 250, and the third was exceeded 250% of the federal poverty level. Those decisions were made basically in the original study because those were the cutoffs that were used for many of the eligibility guidelines for established various public assistance programs, such as Medicaid, affordable care subsidies, and SNAP benefits. And those income categories have changed a little bit for the current public assistance programs, but we chose to keep those the same. So let's see if I can. T, if you want to go to the next one. The current study was conducted in the spring and summer of 2024. And I want to just talk a little bit about how the current study differs from the original study. The primary change is that the data collection modes were adapted. In the original study, we used telephone surveys as well as web panel surveys. And the telephone surveys at that time did include landline and cell phone because it was so difficult to include younger populations without the cell phones. And of course, the older population was still relying at that time on landlines. So for this study, though, we used only web panels from 2 different sources. And the reason that we did that is because two factors really is web panels have become much more representative of the general population. And quite frankly, data collection by telephone has become exceedingly more difficult and expensive. And so we felt like we could justify this change. The second major change that we made was that we did add a Spanish version. So the survey questions were replicated and written in Spanish, and respondents, when they signed or when they logged into the survey, could choose whether they wanted to complete in the English or Spanish version. We did have 290 pet families who chose to respond in the Spanish instead of English. And we did incorporate a web panel and purchased a web panel from a company that specifically specializes in Hispanic families who are Spanish speaking only. Another major change is that we also expanded the list of barriers. And this expansion of that list of barriers was based upon what we had heard in other community surveys that we had done and were reflective of the current state of what pet families were facing. A lot of it was COVID related, but we did add the two barriers of that families were not able to obtain an appointment, or they were not able to obtain an appointment during a time that they were available. So that has changed some and affected some of our ability to compare across the two studies. We also added information about specific information about pets. I was particularly interested in learning more about what types of information pet families need to care for their pets. I had heard in many of my other studies that, and especially from younger families and those who may not have had a pet in their childhood or in their past, about their lack of knowledge in how to properly care for their pet, specifically about behavior issues. And then I know that the industry has really grappled with how to measure the prevalence of economic euthanasia and economic relinquishment. We've really struggled with how to ask those questions in such a way that we could minimize social desirability and allow people to be really honest about how often that this has happened to them. We find that being able to answer this on paper as opposed to answering a question to a specific person helps to do that. And so we developed a set of questions where they could check all that apply of different scenarios, and we wanted to test that. And then lastly, we added human health questions because we know that having a pet in the family affects other family members, and we wanted to know about how those family members were being impacted by the barriers. So I just want to remind you that Claire is going to talk through our findings, but please remember to put any questions that you have in the chat, and we will address those as much as we can at the end of the presentation.
Thank you so much, Linda. Thank you all for being here today. Really excited to see everyone. If you just joined us and you haven't introduced yourself, please put your name and your organization in the chat. It's great to see people joining us from all across, not just the US, but I'm also seeing Canada represented. So thanks to our neighbors there. And thanks so much, Linda, for your leadership on this. Linda really did the majority of the work on this study. And also thanks to all the PPHE team members who have made it possible for this report to come out. So I'm going to cover some of the main findings. And then, as mentioned, we will open it up for a discussion. Any questions that you have. And I also have some questions for you all based on what you may have learned or what you may be doing, since we do have a great group, and I know you all are doing amazing things to address some of the issues that emerged in this research. So if you can go to the next slide. There we go. So we had over 5,000 people in our sample, and these were representative of the different regions in the US, different income levels, people, male, female, different households. They're representative of different household sizes, and overall household types, housing types across the US. Let's see. So we were very happy to see that. And then jumping into the family composition. So one thing that we noticed was that there was an increase in one pet households and a decrease in the average number of pets in the households between the 2018 study and the current study. Around half of the households that participated had just a dog, and then a quarter had just a cat, and then a quarter had a cat and a dog, or multiple cats and multiple dogs. In terms of acquisition trends, we're seeing some differences here in terms of how cats and dogs are acquired, with dogs being more likely to be adopted or purchased from a pet store or a breeder. On the other hand, we see that cats, while also likely to be adopted from shelter and rescues, were most likely to be acquired as strays, and then occasionally as well received from family members or friends. We also saw some regional differences in these acquisition trends, with dogs mostly being a high percent of dogs being purchased in the Northeast, and then the highest percent of cats that were acquired as a stray was in the South and in the Midwest. And there are also some age differences. So we saw that older adults, those over 55 in our age categories, were more likely to adopt and take in strays than the younger respondents. We also looked at spay and neuter rates and reasons why not the dogs or cats were spayed or neutered. 27% of the dogs in the respondent households were not spayed or neutered versus only 16% of the cats. So cats were more likely to be spayed or neutered. And reasons for that: overall cost, particularly for cats, cost was the main reason why they weren't spayed or neutered. For dogs, cost was an issue, but more generally, or more likely, they said that they didn't believe in spaying or neutering or wanted to breed the pets. So just something that you all might see, but it's also to keep in mind, thinking about where some of these beliefs might come from and what the consequences of those are. We saw that lower income households and households in the South had the lowest rates of not spaying or neutering. In terms of vaccination and microchip status, 91% of dogs were current on their vaccinations versus 78% of cats, so dogs are a little bit higher. 48% of dogs were microchipped, a little less than half, versus only a third of the cats. And then we did see that both vaccination and microchip status increased with income levels and were highest in the west of the United States. In terms of barriers to care, as was previously mentioned, we looked at 3 types of care: preventative care, sick or injury care, and emergency care. And we saw that 26% of respondents reported that they were unable to access the desired preventative care. This was up from 23% in the previous study. Overall, we see that barriers to veterinary care were up for all types of care, and then predominantly related to cost, but also appointment availability and clinic hours. So someone might be able to afford the care, but because of their working schedule or other scheduling issues related to either their availability or the clinic availability, they couldn't get the care that they needed. Sick and injury care was also, even though it was a little less likely that they had an unmet need, it was still up a couple percent from the previous study from a couple of years ago, and cost was the leading reason there. And then for emergency care, again, there was 12% of the respondents had reported unmet need for that. And even though that's the lowest percent, it really shocked me because this is obviously emergent care, it's urgent, and it has potentially the most dire consequences of these needs being unmet. So there's a real concern there. Again, cost being an issue, but also transportation and not knowing where to go. So people might have a regular vet that they go to, but they don't have someone to call when there's an emergency, when there's anything that's happening after hours, or they don't have the transportation to get there. Here's just a more detailed overview of the barriers specifically to preventative care by income level. And one thing that struck us that we wanted to point out is that 50% of people in the higher income level still say that cost was a barrier. So this ties into cost of veterinary care and also other things increasing so that even people who are considered middle or higher income still struggle to pay for the cost of care. But we also see higher here among this higher income group is available appointments when they needed it and finding a care provider that was open during the times that they could take their pet. So again, this accessibility was constricted even for the higher income group, particularly around the availability. Then there are some dire consequences of these barriers to care. So we asked people what were some of the negative outcomes if they experienced a barrier to veterinary care, whether that was preventative, sick injury, or emergency care. And in quite a few cases, there was relinquishment of a pet because there were behavior concerns or care concerns that could not be addressed. And then unfortunately, there were also cases where pets died or were euthanized because access to care wasn't provided. And so we obviously are needing to pay attention to this because this is costing lives of our pets and increasing to shelter pressure. In terms of the desired information that respondents are looking for, information about local clinics is something that people are looking for. They may or may not have a regular clinic that they go to, just of what are the options they have in their area, what are the costs. Training was also an area of need. They may have a vet, but they don't necessarily have a place to go if there's any type of behavioral issues or training that they require for their pet. There is also a demand for pet-friendly spaces and emergency boarding. So particularly among the younger crowd, they were interested in training and these pet-friendly spaces. And among the older respondents, we saw more of a need for temporary and emergency boarding or temporary foster care. And in this graph, you also see the desired versus the received care, particularly looking at this last column where there's a big gap between the desired care for preventing behavioral issues and actually who receive the care. So highlighting some main trends, we see that the average number of pets decreased in the household, potentially because of financial constraints. People got a pet during COVID and just kept it to one pet. Nearly half of the households had a dog or had just dogs. And so it was a little more likely they had dogs than cats. And then some of the species-specific patterns include cats being more likely to be acquired as strays versus dogs coming from the shelter or being purchased through a breeder. We did see that dogs were less likely to be spayed or neutered, and this ties into some owner beliefs and breeding intentions, which we can look more into where these beliefs are coming from. And rescue shelter adoptions having higher spay neuter rates, whereas pets who are given as gifts have the lowest spay neuter rates. Overall, we are unfortunately, in spite of a lot of efforts being done, we are continuing to see increasing barriers to veterinary care across income levels, regions, and age groups, with costs being the main factor, but also logistical issues and availability growing there, potentially related to vet workers shortages and clinic saturation that were further perpetuated by COVID. The consequences of the limited access include higher rates of relinquishment as well as pet death and euthanasia, and also increased stress by the households themselves and the people who are living there. So overall, we're seeing a high demand for training, behavioral guidance, temporary care or boarding options, and also just a broader need for education and outreach. So overall, we can look at recommendations in a couple different ways. In terms of affordability, there is a need for subsidized clinics or various spectrum of care options, payment support, as well as increased accessibility, for instance, through telehealth, extended hours, and mobile units. This will decrease some of the transportation and logistical barriers. We see that local resource guides can have a great, can fill a gap here in education and awareness about the resources that are available. And those resource guides should also meet the needs of our multilingual communities. And then also including pets in human service systems and strengthening cross-sectoral partnerships is something that we see the need for in relation to how the pets in our lives impact our own health. So framing this from a One Health perspective, so One Health perspective looks at the various sectors as interlinked. So the health and well-being of our pets is interlinked with our environment and interlinked with our own health. And if we can prevent our pets, if we can promote pet health, then this is also going to impact our own health. And we also need to understand the context of the barriers in the political systems, the transportation systems, housing, and economic systems that they're part of. And one data point that really highlights this is that 44% of the families who face barriers to veterinary care reported pet-related stress. So in terms of some of the things that we are working on as next steps, we're continuing to examine this access to veterinary care data for additional trends. There's a lot of analysis that's already been done, but there's still a lot of data and additional trends that could be further explored. And if you have any specific questions or items that you think we should look into, we'd love to hear that. We are also doing some research on the impacts and role of pets in various populations and settings, specifically right now looking at senior living, substance use disorder recovery, and in the future, a study on veterans. We are trying to understand how social service agencies serve pet families. So in the light of the One Health approach, recognizing that if social service agencies account for pets as part of our family, this could be another way to get access to pet-related resources and services when these services become more integrated and when there's more of a cross-sectional collaboration between animal welfare agencies and social service agencies. Because of this need for behavioral care and training, we are also interested in doing a similar study, but then really looking into access to behavioral care, specifically related to dogs. What are the needs of people? What needs are being met? What needs are unmet? What are the barriers? And also who is providing dog training? And then again, because of this emerging need for temporary foster care, when people are temporarily hospitalized or maybe have to go to a domestic violence shelter, temporarily unhoused, or for some reason they temporarily can't take care of their pets. What's the prevalence of these temporary programs? How do we assess the impacts of these programs? And what are the success rates in returning to owners? Okay, so I know I talked a lot. We are definitely interested to hear your questions. So I will ask Caitlin if any specific questions came up, and then we also have some questions for you if time allows it. Thank you.
Yeah, Claire and Linda, thank you so much. We did have a couple questions come in while you were presenting. So I think we'll just jump right in. The first one we had come in has to do with spaying and neutering. So Claire, you shared that 19% of the respondents indicated that their pets weren't spayed or neutered because they didn't believe in spaying and neutering. Was there any explanation? Was there any like follow-up qualitative collection, data collection that might have explained what people meant by not believing in it or why they don't believe in it?
Not in this particular study, but it was definitely something that has been curious to us. Linda, I don't know if you want to talk a little bit more because I know that this stood out for you as well.
It did, and we did not explore it in this particular study. And so, but that is something that I think my personal opinion is it needs to be explored, and that would have to be, in my opinion, more through qualitative data and participatory research of really exploring where these belief system originated and if there is any information that we could provide that would perhaps change the perception of the folks, because I suspect that some of the beliefs are not necessarily based upon other cultural factors and maybe just from misinformation. So that's a great question.
Yeah, yeah, thank you for sharing that. So moving on to the next question, has to do with vaccinations. The person that asked this question is wondering if we defined what current on vaccinations means, and if that actually is showing what we want it to, what we hope it means when people say that they're current on their vaccinations.
Another great question. But yet, no, we did not define it. It was self-defined by the respondent. What the question read, is this pet current on their vaccinations? And so it would rely on, we have to assume, and it's perhaps not a good assumption, but we did have to assume that the person responding to the question would have been aware of what the proper vaccination protocol was. So I can't really answer the question of whether it's showing what we hope it to or not. I do think, though, again, that if I recall correctly, the pets that were acquired from shelters and other foster programs show the highest rate of highest vaccination rate, which would be consistent with what we know that the shelters will not, you can't adopt a pet until they are vaccinated. So I'm hoping that it is a reflection of reality. And yeah.
Great, thank you. Next question, were there any questions in the survey that had to do with telemedicine? Did anybody indicate any kind of interest in telemedicine?
Unfortunately, it was not addressed. And I'm hoping that Claire and the PPH team are making note of that, because that is something that needs to be explored in future research.
Yes, definitely. So we didn't specifically talk about that in or ask about that, but there were people who might have, mentioned it if there was an open-ended question, but generally most of the questions were closed-ended. But I suspect that there is, given other healthcare trends towards telemedicine and telehealth. and that this could reduce some of the barriers. But it's definitely an area we can look more into and look at communities who have implemented telehealth and look at the success rates there.
Great. And back to the question on spaying and neutering, the chat is wondering if there's any potential for PPHE to identify the respondents in this survey and follow up with some qualitative questions, or if that'll be more forward-looking research.
I can address the former part of it, but I can't address the forward looking. Unfortunately, there is no way for us to recontact those who participated in the original study. It was a web panel and it was a blind web panel, so that we don't have contact information for those who did complete the survey.
Yeah, generally we don't ask contact information in the surveys because the anonymity helps people be more open and honest. But again, this is definitely an area where we would like to explore a little bit more about where these beliefs come from, how and if they could be changed and what that looks like. So a more in-depth qualitative study would be very fitting for that. If anyone wants to collaborate with us on that, let me know.
Great. Thank you. We just had one more question come in regarding specifics of the study, and then we have a couple more general questions. So in terms of obstacles to accessing veterinary care, did you look at that and find any significant data differences based on where animals were acquired? So based on where they were acquired, any differences in access to veterinary care?
I did not, but that's a great suggestion for Claire and the team to explore that further, because I know there is ongoing research being done using the data set. So that would be a very important stratification to look at.
Yes, exactly. So we looked mainly, as you could tell, at those income levels, at regions, and then at age groups. So we were consistent and we could compare the results from the previous study, but there are definitely other stratifications that I think are worth looking at. So that is one of them. We'll add that to our list of things to further explore.
Great. So thinking more broadly about this report, there's a lot of enthusiasm about this report. People are really excited about the findings that have been shared. But there's interest in specific recommendations for communities based on what was seen in this report. So do you guys have anything that you want to share today in terms of recommendations for our attendees?
I think we covered in this presentation a little bit about that, and we maybe didn't go as much into detail in the report itself. But if we find that this is an area of need, then we can produce deliverables that are more specifically focused on that. And we're happy to work with people in developing materials or whatever, really, again, whatever kind of the need is that you're seeing, based on the results that we found. So again, there was a slide in here that kind of talked a little bit about the recommendations, but if there is a need for having something more in depth or having a more of a how-to guide or something like that, those are definitely things that we can provide.
Great, sounds good. And then kind of along that same vein, but more specifically, the group is wondering if there's any information on lobbying or policy action specifically for pharmaceutical companies and the cost of preventative treatments, for things like flea and tick. Do we have, any thoughts on that aspect?
I know that the original study discussed that, but this particular study was just the national study, and so we didn't really explore the legislative or policy implications. So but I don't know whether PPHE it plans to continue or to expand their scope to take that on. So
Yeah, our current scope has been mostly focused on research, education outreach, and then collaboration and communication. So bringing people together. We have a One Health forum, a One Health journal that's going to come out, the first issue next year, and a summit. So we haven't really been as involved in the policy or advocacy space. So I don't know if that's something that we might be involved with in the future, but I'm personally not as familiar with that. And if there's any legislative changes that could be recommended. Oh, okay. Thank you. I see that there's, thanks, Anna. So Anna, who is the executive director for Align Care Health, is working on some policy proposals. So thanks for putting that in there.
Great. Thank you so much, Claire and Linda. Thanks to Anna for sharing that information. That's all the questions that I have from the chat right now. Claire and Linda, I know you had some questions for the audience, so maybe we can get to that, and I'll let you know if anything else comes in.
Yes, great. So for the sake of time, I won't go through all these individually, but something that I was curious about hearing from you all is what stands out to you. I know that a lot of you are working directly in this area. So is there something that stood out to you either because it really resonated, yes, this is exactly what I'm seeing, or something that surprised you that you maybe weren't expecting? And then would be curious to hear, and you can put this in the chat or ask to unmute or just kind of a food for thought moving forward. We're curious to see how these findings could potentially be used in your work. So whether you are in research, education, veterinary care, animal welfare, the different types of roles that you hold, is this helpful? How are you going to use this? And then we started talking a little bit about this in the Q&A, but what other information or data would you be interested in? Because this could be something that we could look at or someone else could look at moving forward. So I think if you raise your hand, Caitlin or T can unmute you if you wanted to share anything verbally, but also feel free to put something in the chat that responds to this.
Yeah, Claire, we did have a response come in through the chat already, identifying another missing piece to look into, which is financial literacy and individual budget planning for pet families. So Jillian Robles shared that many of her clients need that support so they can plan for the future. So that's an idea, again, from Jillian Robles, another area that we can look into.
Great, thank you.
I thought it was interesting to see that there's still people that don't know where the vet is. But I would love to know if that is because there are no vets, because I think the statistic is like 600 counties without a single veterinary professional, including vet techs, right? So is it because there's no vets there, or is it because they don't know where to go to the vet or where to access information to find a vet? So, but really good breakdown. It's a very interesting report.
Thank you. That's a great question. And that's something we can look more into as well. We can kind of just pull out that section of people who don't and like, what do we know about this group? And any information we wouldn't be able to find in the data set can lead to additional questions for future research for sure. Thank you.
Just not to interrupt, but Gilberto, we were just talking about this. There may be some folks who are on our staff, perhaps, who didn't know where to call for an emergency veterinarian because, you know, they go see their regular vet. They don't know who the emergency vet might be. So we need to make sure that all of our veterinarians have posted on their website, on their social media, on their answering machines, where do they go in a case of emergency, so people do know where to go.
Great. So Claire and Linda, we have a question in the Q&A as far as what kind of information people said that they wanted. And I'm pretty sure that people can see a detailed report or list of that in the report. Have we looked at all though on how people want information to be delivered to them? So we know what people want, but how about how they're getting their information?
That's a great question that I think would add to future studies because we did not explore that in this particular survey. But that is a great question.
Great. We have some other suggestions for future research. So understanding relinquishments to shelters for medical reasons. So Gary Weitzman shared that of the nearly 30,000 animals we take in a year, that doesn't seem to be a major factor for them. So Gary's interested in understanding more about relinquishments to shelters for medical reasons.
That's a good point. Yeah, I mean, I guess it's a good thing that you're not seeing that. We can take a look at that subsection again, who said they had challenges, and then where there was a case of relinquishment, see if there's anything else we can more learn there. But if not, maybe to see. Oh, yeah, that's a good point. People maybe not always honest. There could be other factors at play. It could be culminating factors, could be behavior plus vet care plus, something else, or people are not always forthcoming about all the reasons. And maybe it's not as common.
Great. Another area for future research. So Shannon Glenn shared she's interested in learning more about how increasing CVT or RVT's ability to provide care and the relationship to the cost aspect of that. If there can be any pushback on VCPRs for those basic visits. So a lot of good areas for future research. Another one, interested in why so many people are still not adopting from an animal shelter. So really want to define where pets are coming from and what the reasons are behind people's choice of acquisition of their pet.
Yeah, I think just, anecdotally, sometimes there are stigmas with shelters. Um, and then also if people are getting pets as strays or gifted from a family member or a friend, then, they didn't really actively go seek it out. And so they're kind of in the group where the pet came to them and then now they're dealing with the pet, but they might have not been actively involved in that decision.
Another area that was brought up, oh, sorry, go ahead, Linda.
No, I was just going to say, and we also know from other research that we've done that sometimes the requirements that people and the rules about adopting have prevented people from using the shelter. And unfortunately, we know from human behavior that, if someone's denied adoption one time, they may not return to a different shelter, a different foster program. So, but that is something. And also during this time, COVID was happening. I mean, it was post-COVID, but many of the shelters were closed or had managed intake and outtake. And so I think people may have pivoted a bit about where they do source and where they do find their pets. But again, that's anecdotal on my part. But we didn't explore that in this particular survey.
Great. A couple more ideas coming through the chat in terms of things to look at in the future. Jessica Henry shared that they added access to affordable end-of-life services for low to moderate income pet owners, and that made a big difference. So they're wondering how many pets have, maybe kind of been suffering just waiting to get access to that kind of service. So definitely something to look at in the future. Um, a lot of chatter about the vet workforce shortage. Is there anything that you all want to share in terms of the workforce shortage in veterinary care? Is that something that PPHE is thinking about looking at in the future?
I personally don't have a whole lot of knowledge about this. I think Dr. Blackwell and some of our colleagues who have been specifically in the veterinary medicine and workforce development space for a long time will have better insights into this. My understanding is that while their enrollment has been fairly steady because more people are having pets, there is just that's why the need is not or the supply is not keeping up with the demand out there. And my understanding is also that there's concerns about burnout and the self-care for workforce for veterinary professionals as well. And this, to be able to continue practicing at the level they have been practicing requires a lot of additional support for these professionals. And that's also impacting the workforce availability.
Yeah, thanks for sharing that perspective.
But I'd love to do more work on that as well.
Yeah, for sure. Going back to findings from the report, Wilfred O'Pira shared that the barrier that caught my attention is that still half of the people in the highest income bracket cited affordability as an issue. So following up with that qualitatively to understand the nuances there, people are really interested in. So another question, going back to the report, we cited access to mobile vet care in the report. Somebody is wondering if there's a model for mobile or sliding scale vet care that you can direct people to.
I am familiar with some localities who are, successfully doing regular mobile care, specifically in unhoused populations or in rural populations. I think, in light of the One Health approach, if a mobile vet was provided with other resources, like a vaccination for humans or other type of human-centered care. I think this would be a great model, and I know that there are a lot of communities out there who are doing this, but I don't have necessarily a specific sliding scale vet model. I don't know if T or anyone else can speak to that.
As I'm looking at all the folks here, I'm looking at Emily, Dr. McCobb, who runs a fantastic One Health approach, helping humans and their pets at the same time.
Yeah, so I know that there's people who are, here today and also out in the communities doing great work that is along those lines. And maybe we need to bring these people together or, highlight these models and show how they do it financially, logistically. And that could be an inspiration for other communities.
Yes, there has been some discussions about One Health clinics and models for that. So if you all, you can scan that code that you're looking at right now. That'll take you to the One Health forum, but definitely sounds like we need to have another meeting with organizations who are already running One Health clinics, but those that want to as well. What would be entailed in that and how they can do it. Thank you all.
Yeah, Dr. McCobb mentioned in the chat that there are a lot of models to look at. Some people are suggesting some. I think as we start to wrap up this meeting and move the conversation to the forum, that's a great place for us to share some links to those models for people to look at and some other resources.
Thank you. I'll be the first to acknowledge that I'm still fairly new to the animal welfare field, so I am catching up and really relying on all the wonderful people around me who have been in this field for a very long time. I'm happy to, help connect people and help share some of the models and the knowledge that's already out there.
Great. Well, I've got no more questions, and I know we're coming close to the end, so I'll turn it back to Claire and Linda to wrap things up.
I just appreciate everyone's being here and all of the great questions that have been asked, and appreciate the opportunity to share the findings.
Yes, thank you all so much for being here. T?
Just again, we're going to save the chat and thank you